Hi, clinic owners. So today, what I want to talk about is the topic of my patients keep dropping off treatment too early. So I hear this quite a lot from clinic owners that they're frustrated that their patients are dropping out early out of treatment or self-discharging, as it were. The patient maybe is not compliant with the treatment plan that you're providing, and then they start to complain that you're not getting them the outcome that they want, and maybe even they're giving you bad reputation, bad review, which is unfair because they have not finished the treatment plan and they have not given you the opportunity to completely fix them. So what typically clinic owners want is they want the patients to stick with their plan all the way to the end, because if you could get every single patient to stick with the plan all the way to the end, if you could get every single patient to be fully compliant, then you would find that you would get your patients in almost all cases 100% better. Now, I understand you can't fix everybody, but pretty much 99% of the time when I speak to clinic owners, they say, yeah, if people stick with the plan, I can get nearly almost everybody better. Not 80% better, not 75% better, but 100% better. And those kind of patients will be happier and they'll send you more work. They'll send you patients like them. They'll refer you more work. Now, there's 3 points I want to make about this. So the first point is that if you can get a patient to stick to the plan, it's actually better for them. It's better for them because rather than going, say, 2/3 of the way through the treatment plan and getting, 80%, 90% pain relief, and then them stopping, and then the problem is going to come back again, maybe in 3 months, 6 months, whatever it happens to be. If you can get them to stick with the plan and go all the way to the end and get 100, 105% better, well, then they're going to get a much superior outcome and it's going to be much more longer lasting for that patient. The second point is it's going to be better for your business. Why? Well, firstly, it's going to increase your turnover because that patient is going to keep coming. They're going to continue to get to stick with the plan and turn up for appointments until such time as you have them better. It's better for your staff. It's better for your staff because you're not going to have complaining patients or stressed patients, putting pressure on your staff, because they're happy to keep going with the treatment, understanding that sometimes these things takes time. And it's going to be better for your patients, as I said, and that in itself will end up with better reviews, better reputation, and a better referral system. And the third point I'd like to make about this is what you really need is you need to have a system to ensure that this happens. And what it does, it'll help more junior staff to follow it, keeping up the compliance levels that maybe the more senior staff were able to get, maybe you're able to get, but your junior staff are not. So if you can systemize how you do that, what you're going to find is you'll be able to reduce the business's dependence on you to get patients to stick with the treatment. So if you can systemize this, and it is possible to systemize this, then the business becomes less dependent on you. And you can step away more from the business and it will not have a negative effect on its cash flow. So to recap, what you want to do is try and get those patients to stick with a plan. The psychology of converting is key to this, and it's usually something that a clinic owner is just pretty good at. And it's better for your business. It makes for happier patients, it makes for happier staff, and it makes for greater turnover and freedom for you as the business owner. Now, this is the sort of stuff that we work on in our coaching program. We teach our clients, our clinic owners, just like you, how to make sure that patients stick to plan all the way to the start. In fact, we show them how to get the patient to commit to treatment plans that last up to 4 months in advance and to pay in advance for all of that. If that's something you're interested in finding more about, then go to our website, morepracticeprofits.com, book a 10-minute triage call with one of my team. We'll have a quick chat and see if we think we're a good fit for each other, and we'll take it from there. So until next time, this is Lorcan O Donaile, podiatry business mentor, signing out.